My name is Mike Shimmens, and thank you, Randy, very much for the introduction. I'm Executive Director of 3RNet and have been in that role for almost 8 years now. Very delighted to be with you today. My background is over 20 years of recruitment experience. I started as a physician recruiter with a hospital, and we'll talk a little bit more about that, but I started with a hospital here in my hometown, Jefferson City, Missouri. 167-bed hospital. I worked with all different specialties and recruited, did a lot of work with new graduates, but also nurse practitioners, physician assistants, but primarily physicians. And it's been a really whirlwind. After that, I worked for the Missouri Primary Care Association, where I was introduced to 3RNet and became a board member and then became executive director. So all those things have led me to here, talking to you today a little bit about your job search. Some of you may already be employed, already have your job, and are already all set. Some of you may have not even began the process yet. Again, if you're in medical school or maybe even early in residency, you've just been too dang busy to do all this. And we want to try to take give you some tools and resources today very quickly. This is not a long presentation as far as what I have, but I'd like to be able to answer questions and talk to you about any concerns or issues that you're having maybe in your process so far. So I'm going to touch bases on a few things, a few slides, and we'll give you that opportunity. And then after that, you'll have an opportunity to kind of interact with us on questions and even talk amongst yourselves with questions you have about demystifying the rural job search. So first of all, I want to say congrats to you. You are highly sought after. You're going to have a lot of folks, if you don't have them already, contacting you about all the different types of jobs out there. There are many family medicine jobs out there in all different sizes of communities, different areas of the country, different type of practice style. So the good news is you will not have a hard time finding a job. The tough news is that sometimes other people tend to drive the process if you don't take control of it yourself. So I'm going to encourage you to do that with some tools and tricks that we're going to talk about today, including how do you go about knowing who these opportunities are, knowing some of the language of searching for a job, especially in a rural area, some of the important key players. And I want you to be able to feel like you're in charge of the job search, not somebody's telling you where you have to go and what you have to do. So we're going to try to have you reach for that today. And basically, are you considering a rural area of the country to practice? And thinking about what is in your profile, what is it in your makeup and your skill set and what you're wanting to accomplish in your job, why are you considering a rural practice? We'll just touch on that a little bit as well. Here are some of the things that often lead people to rural practice, not always, but often. First of all, personal experience. You may be from that type of area, or just desire to live in an area that's maybe more rural. Also, a lot of people like the impact that they can make on one single community or a whole area, a region of a country, a particular state, that's involved in the community, not just kind of showing up and doing your job and seeing patients. That's obviously a huge part of it, but also, having involvement in the community events, activities, whether it's your children or your own or a spouse or a significant other, all of you kind of involved in that population, really becoming integrated with it. Some people really think that's a great way to practice medicine, and we agree. Loan repayment, obviously, that's one that's very important and often available and something that you want to consider. The autonomy of a rural practice, I can do things my way, I can kind of set up the way I want to do things. That's always important as well. The scope of practice. This has been something that, when we talk about your personal statements, I want you to think about your scope of practice. This is something that in my state, where I'm at in Missouri, it makes a big difference of what a family physician can or wants to do in their practice, possibly where they decide to practice. For example, again, if you know all about the OB crisis out there, if you're interested in practicing OB in a rural area, you might have to select more cautiously or carefully, just because not every community offers that. A lot of them have been dropping it. Hospitals have, unfortunately. A lot of issues around that. So if that's a scope of practice issue that you need to have in your practice, you'll want to identify that early on and be looking for jobs, obviously, that specifically offer that. Shorter commute can be. You can live right there in town, 5 minutes away from your office. That's kind of nice. It's the same way with the recreation. A lot of people like the recreational opportunities of living in a rural area, whether it's mountains, rivers, beaches, wherever. But you just want to be out and away from people. Sometimes that is a very nice thing to be offered. And then the work-life balance. Again, that's specifically to you. How do you consider a work-life balance? But some people consider 60, 70 hours of work still okay as long as they're doing something they love. Others, maybe they don't want to do that, but how does that fit into your lifestyle? So all these things sometimes and more are packaged into why you might want to look at a rural area. A little bit of lingo I talked to you about. You kind of got to know who the players are in rural healthcare when you're talking about maybe the type of facility you want to work for. So I threw up these 4 and some links to them to kind of start to understand the language. A rural hospital is basically anywhere. There's a lot of different measures of rurality. I don't have enough time to get into that today. Maybe Dr. Longenecker can fill you in on that later. But for our purposes, there are rural hospitals, but there are also critical access hospitals, which are those small hospitals that have a certain designation from Medicare that's going to offer them enhanced reimbursement, and typically they're under 25 beds or less. So those are spread out throughout the country. I believe that critical access hospitals are located in 46 of the 50 states. If that is something you're looking for, you'll want to know what a critical access hospital is. Same with a rural health clinic. Now, rural health clinics are even more prominent depending on the state you're in. Typically, those are, again, more of an outpatient clinic setting. So you'll want to know what a rural health clinic is as well. And then the federally qualified health centers typically go by both that name as well as community health centers. You find those located both in urban, rural, and all sizes of communities across the country. And there's a link there to get to know more about what a federally qualified health center is. And again, a lot of those are through a link here, the RHI Hub, which I'm going to talk about in just a minute. Those are great ways to get resources and doing a little bit more investigation. I encourage you to strongly to investigate what type of facility, if you have not, do you want to work in, because that does make a difference in your job search. You really want to kind of pay attention to what those are. So here's some of the guides for assistance. Every kind of search needs a guide. Here are some of the ones that we wanted to make sure you're aware of. 3RNet is a membership organization. We do have members in every state. Our job board is primarily what people know us for, but we also have these individuals that are trusted resources because they are a neutral party in this process. They work typically for state or state organizations. A lot of them are governmental entities, and they're there to help you. They want to have you succeed in their states, whether it's through loan repayment or finding a job in one of these safety net facilities. So they are a group that you want to know who they are. Equally important is the primary care office, and sometimes these are a little bit harder to find, so there's a link here that you'll want to find, depending on the state or states you may be interested in, the primary care office. The primary care office handles issues including health professional shortage areas, National Health Service Corps. If you happen to be a J-1 visa waiver holder, they are an important part of that process in each state. So every state has one of these offices. There's actually 54 total because a couple of U.S. territories have them, including Puerto Rico and Washington, D.C. So take a look at your primary care office and get to know who they are. If you have not kind of investigated what kind of services or how they're involved in this process, you'll definitely want to get to know them, especially if you're looking at loan repayment issues. That's going to be a very important player for you. Same way with RHI Hub. Rural Health Information Hub is based there in the University of North Dakota. It's a great resource for all things rural as far as information. If you have not checked that out, I strongly encourage you to get on and become. They send out a weekly newsletter. There's a lot of ways you can get involved with the Rural Health Information Hub to kind of keep track of information out there, because again, the more knowledgeable you are, the better choices you're going to make when making an employment decision, which is coming down the pike. Also, then the State Office of Rural Health. Every state does have a State Office of Rural Health. They do a lot of different services for facilities and also can connect you with resources that you may need to have as well. So I put them in there as well. A lot of State Offices of Rural Health are actually 3RNet members as well, so they will duly work on both. Okay. We talked a little bit about developing your profile, and that is what we wanted you to do today. So I just want to give you a couple tips. What is the ideal? Sitting there today in the capacity you're in, with where you are in your training, what is it you think right now would be your ideal practice? Can you envision it? Can you think about it? What type of practice? Is it employed? Are you going to open up your own shop? Are you going to go primarily anymore? Most new people coming out, new health professionals coming out are being employed, but there are other options. So what are they? What type of practice? What type of community? Again, the details about the scope of practice was really important. How do you see yourself practicing medicine when you begin your first practice and even down the road? Do you have a plan? Are you wanting to do research, for example? Or there's all kinds of things you want to take into account here. So develop that with this in mind. Same way with the type of facilities. We just reviewed some of them. There are many other types that I did not go into. Do you want to be employed or not? Like I said, that is a big part of it. Primarily, that's the main part we see, but there are other options. The type of community. Can you feel the type of community size that you want to be in? Years ago, when I first started recruiting, I talked to a young resident, a new resident out of the state of Ohio. He had never been to my state in Missouri. He had been doing interviewing, and he had been interviewing in towns of probably 10 to 12,000, and a lot of them were located on the interstate, and the people he were talking to were calling these rural communities. And I happened to call him because I saw in his profile that I had from Practice Match that he was interested in Wyoming, Montana, some really frontier states, and here he was from Ohio. So I gave him a call because I had a town of 1,200 people in the middle of kind of nowhere, Missouri, and I was having a hard time with this. And I called him and I said, "What kind of size of community are you looking for?" And he goes, "I want something really, really small and off the beaten path." And I said, "I've got the perfect place for you. I've got the perfect place. I know. It's 1,200 people, and you're 45 minutes probably from the nearest place, and there's all kinds of hunting and fishing and that kind of stuff in the area." Loved it. Loved it. So we were able to recruit him to Missouri, but he had to know the size of the community. What is it that was important to him? When I spoke to his wife, they had 3 kids at the time already. He was finishing residency. Her main thing was she wanted a grocery store. I'm like, okay, brand new grocery store in this town, and that was her main requirement. It was very simple. So I was able to do that. And again, so you got to know kind of what kind of community at least are you thinking of originally. This may change over time, right? You might make different decisions saying this is maybe not what I want anymore. But at least if you can have that in your profile, it will help you narrow down all the activity you're going to be getting when it comes to the job search process. So here are a couple. If you haven't developed a CV yet, you will be, and hopefully you have done this along the way. I'm sure even getting into medical school and residency, you've probably done this. A couple tips. I won't go through these, but you basically are trying to get a neat 1 to 2 page overview of what you're talking about, or what your background is, all the particulars of your work history, especially. If you have any research at this point, you can certainly throw it on there. You do want to have your contact information available for those that are going to be serving as reference, and make sure that you regularly update that, because that is something that employers and recruiters will probably be asking for. It's best to have that kind of prepared ahead of time. And you certainly want to be, again, very upfront and honest with them on how this works. Back when I first started recruiting, I think some of these tips are on here because I did see occasionally people put Social Security number or add a picture to their CV. Not really something you want to do in this day and age for sure. Certainly Social Security number, but even pictures are something you want to really avoid as well. So those are just some tips on CVs. We'll go from there. If you have some special considerations, we at 3RNet have some tools and guides on our website that will be important for you, I think, and giving you kind of a start, especially that loan repayment guide. It's pretty basic, but it gives you some ideas to start thinking through what type of loan repayment you're looking for, what it limits you to. Again, not all states have state loan repayment, but many do. National Health Service Corps does cover every state, but there's a lot of restrictions, a lot of things you got to know about that. So you need to start doing a lot of investigation on this if you haven't already got your loan repayment. So again, use your 3RNet members and PCOs as your guides if you have questions. Same way if you happen to be a J1 visa waiver holder, that is a very complicated process for getting employment, and certainly we have a guide for that as well. And then if you have not come across, I've used the term HRSA, or Health Professional Shortage Area. If you have not come across that term before and want to know more about that, we have a guide there as well. This is a very basic guide. I don't encourage anybody to dig into the real specifics of what a health professional shortage area are. It can blow your mind, but you do have to know what that score is for a particular community you may be looking at. That will come into play when you're looking at National Health Service Corps for sure, possibly state loan repayment programs as well. So that's one of the early things you'll want to ask as you start looking at communities. If you are looking, for example, if you're a National Health Service Corps scholar, you're going to have to look at a pretty high HRSA score, probably I think it's 17 or 18 or higher right now. So you'll definitely want to make sure you know what that community or what that facility's HRSA score is. And again, I'm not going to spend a lot of time there, but that is a very important part of this. And if you have questions about that and we get to the question part, I'd be happy to answer those as well. Just a quick note about recruiters. You probably have been hearing from them already. I used to do a presentation years ago in my work at the Missouri Primary Care Association. I went up to Kansas City and talked to first-year residents right out of medical school, first year. We talked to them in July, and I told them, you are now on the grid of every recruiter in the country, because residency programs primarily start putting pictures up of their new residents right when the new class starts. That means every recruiter in the country now has access to you. If they didn't before while you were in medical school, they certainly do now when you're in residency. And that's why your call level from recruiters probably picked up tremendously when you hit residency, or again, if you're not in residency yet, it will. In-house recruiters are typically those that worked for a hospital, like I did. I worked for St. Mary's Health Center in Jefferson City, Missouri, part of the SSM healthcare system. I was full-time in that role. I was very fortunate to be full-time in that role, and I represented my hospital when I went out and talked to physicians or any other health professionals I was recruiting. Typically, we are not fee-based. We're part of the organizational structure of the hospital or the entity that we're recruiting for. And there's an organization down there, there's a link down there called AAPPR. That is the organization for in-house recruiters. And that term is still used primarily. So if you are hearing from recruiters all the time, you can ask them who their employer is if you want to kind of know who you're talking to and where their motivation lies. Quite frankly, my motivation lied in my hospital, and I wanted you to come to Jefferson City, Missouri, or at least my region. That's not always the case if you're talking to the second people on here, which are headhunters or outside recruiters. Typically, they are hired by a facility to help generate candidates and send them to them, and there is usually a fee on the back end of that. So every time they make a placement, there is a fee to the company that they work for. Not a bad thing. They are a necessary part of this process, but you do want to know who you're talking to because their motivation may be more in placing you somewhere that works for them, that they get a fee, than necessarily your best interest. So always keep that in mind. If you haven't already come across it, again, you've probably been talking to recruiters for a long time, but if you haven't, always ask them kind of who they work for. There is a national association. There are many reputable recruiting firms out there. Again, I'm not bad-mouthing them. They're a necessary part of this. If you're trying to find a orthopedic hand surgeon in central Missouri, I had to use them. There was no way. I mean, there was only 30 or 40 of them a year to even choose from. It's a very small profession, so we were using them quite a bit. Primary care is a very difficult search right now. Many hospitals and other types of entities are using recruiting firms to help find candidates. It's just a part of the process. So I just want to make sure you knew who they were, how they operate, and again, what their motivation is in this whole process. Okay, sorry about that. Okay, and lastly here, we want to talk a little bit, again, kind of one of the purposes of today was to talk about job boards. This is probably the #1 way which you're going to be looking for, seeking, hearing about jobs. Again, 3RNet is just one of the probably thousands of them out there. 3RNet is a little bit different in that we are a nonprofit organization that works with a group, 54 members of other nonprofit or governmental entities, including Indian Health Service and VA. You can do a profile on there. Some of you may have already gone through that process. If not, we'll talk about that a little bit more. But as soon as you become a resident, there are companies such as Practice Link and Practice Match that start calling you to set up a profile, right? And if you're the residents in this call or in this video, you probably already had this, and you are now in their system as candidates, okay? Because they call and do a full profile. You tell them what communities you're interested in, and you start hearing from people all over the place. So these are some of the more active types of job boards. Now, there's many, many others out there. The AAFP, for example, has their own job board. Some of them you can fill out a profile. Some of them you just go in and look, like a monster or something like that. You're just looking for jobs. But again, the better you have defined what you are looking for and you control the process and understand that, none of them control what you're looking for. You control what you're looking for. They are working for you, trying to find the best fit. Whether that's a recruiter, whether that's inside, outside, or how they're trying to help, these are all resources that you want to have to link into. So the assignment today was to kind of look at yourself in scope of practice and what you're really looking for, size of community. If you're interested in rural areas, certainly that's what the theme was today, because that is very much needed, and every state out there, regardless of the size of the state or the location, is looking for rural family physicians, and there will be plenty of opportunities out there. So we have a little exercise I know that's going to be set up to kind of help you do that. I'm going to go ahead and stop here because I think we want to have opportunity for questions and certainly get to our assignments. So Dr. Longenecker, I'm going to turn it back over to you at this point. And again, I appreciate your patience as I was struggling to get this slide deck up. But thank you very much. I look forward to your questions.